You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Hot topic today, what you need to know about breast surgery. Not all doctors are approaching breast enhancement, breast lifting the same. With us, we have an expert on the topic, Dr. George Brennan. Dr. Brennan, welcome to the program.
Thank you very much.
Always a pleasure to have you on the show.
Thank you.
I think for people that don't know you, I mean, you have medical texts written for doctors. Is that right?
That's exactly right.
Tell me about this book. What this is written for doctors?
That's a textbook that is for the professional sector, and it's for doctors, and it's a very technical book. It's not for the lay public.
Now you also have another one for the public. Tell me about this one. What is this?
This is a book that we recently wrote, and it deals with the idea of creating beauty.
Okay.
And it talks about the industry of cosmetic surgery and the beauty industry.
They can order this book online. I want to make sure the cameras pick up on this.
People can order that book online and on Amazon.com.
It's very interesting, by the way. I mean, I've learned a lot because even though I interview a lot of plastic surgeons and doctors, you have stronger opinions than most. And also your results are better than most.
Thank you.
So that's good. So today we've invited you on the show to talk about breast surgery. First, tell me about your practice, because you don't just do breasts.
No, in fact, I've limited my practice to cosmetic surgery from day one, and we do in our clinic we do cosmetic surgery literally from head to toe. And so we start with treatment of baldness. We do all types.
Really?
Of,
so you do hair implant surgery, or?
Yes. Okay. Yeah. And both in men and in women.
Okay.
All right, and then we have two basic objectives. One is to create beauty, so where we're changing the basic shape of a face or a body to make it more attractive.
All right.
And then the other concept is to maintain beauty and to do rejuvenative surgery. And
they do this in your, I guess you have the Hot Surgery Center in Newport Beach.
Well,
is that right? What's the name of it? It goes into your name, or what?
No, it's called the Newport Beach Center for Surgery. And this is a multi-specialty, fully accredited outpatient surgery center. And so in our clinic, we have a group of doctors from a variety of specialties, and so that we all work collectively as a team with a common goal of making a person look better, literally from head to toe.
Now, you've been doing this a long time. I should mention for people watching this, former, past president of the American Board of Facial Plastic Surgery.
True.
And you're also head of the Facial Plastic Surgery Foundation.
Yes.
You get together and share ideas every year with your feisty beliefs sometimes. Yes. Is that right?
Yes.
Yeah.
And every year we have a meeting, typically in Newport Beach, where we invite doctors literally from all over the world, and we have and from different specialties.
Okay.
So that we have cross-fertilization of ideas.
Are you at the top of your game right now? I mean, do you feel that way? Like you're better now than ever as far as facelifting, breast surgery, whatever?
Yeah.
You do?
In my mind, I'm as good as I've ever been, and I will match my results with anybody
with
in the
anyone.
world.
Okay, breast surgery, big topic. You brought a lot of things today. I'll let you start wherever you want. Give me the different categories of things you want to talk about today.
Well, first of all, I think that we already mentioned that we do our surgery in a fully accredited outpatient facility.
Okay.
And that is very, very important. And our credo is patient safety.
All right.
And so the patient then has an option of coming in and doing outpatient surgery and going home that same day, or we have an overnight facility.
Very nice.
So the patient has an option.
Better than the Four Seasons.
Better, yes.
I know we invited you to talk about breasts, but I saw those photos with the body lifting things you're doing. I'd like you to show those and explain what you're doing there.
Well, some people lose a significant amount of weight, and
there's a lot of bariatric surgery out there.
A lot, and it's becoming more and more popular. But when people lose 150 pounds, they have a tremendous amount of extra skin.
So it's almost like a tummy tuck for the leg. Is that what this is?
It is.
In a way?
So you can well imagine how happy that person is. And so that's just one of the components of body contouring. And so, and I know we're here today to talk
about
specifically about breasts, all right? And I think what the audience needs to know is that breast surgery is not only for women. It's for men as well.
Okay.
Because
I got to hear this one, Doc.
all right. Because some men are born with what we call gynecomastia, which means that they're born with a female type breast. Okay. And so we're able to reverse that and get dramatic results.
All right.
Some people are overweight and they need to have a breast reduction, men. And then there are some men who simply haven't developed good muscles.
All right.
And so they want to have breast implants.
Really? You got to be kidding. So men are getting breast implants.
And here's a perfect example of a man.
Wow, it's subtle.
Who had a breast implant, and there's no question that he has more defined pecs and feels better about his physical being. And so there are various things that we do for women, and one is to make their breasts larger. Sometimes women's breasts fall, and so we want to lift them. Sometimes they're born with excessively large breasts, and they want to reduce them. And so, and so they have different clinical conditions that have to be treated differently.
Okay. Now, by the way, if anybody's tuning in, especially because a lot of people know about breast augmentation, or they think they know, and I've interviewed hundreds of doctors on breast augmentation. But if you have breast augmentation or considering it, you got to hear this. This is a different take than I've ever heard, about what you're about to say as far as creating a natural breast. And there's others, that agree with what you're saying, but this makes absolute logical sense. So, I'm sorry to interrupt. Go ahead.
All right. Well, we have a certain philosophy about how breast augmentation should be performed.
Okay.
And number one is when a patient makes an appointment, we ask them to bring in their dream bra.
Okay.
Right? And so for example, they come in with a bra, and then we show them a variety of implants that they can choose. And basically, there are two types of implants. One is an inflatable balloon that we fill with salt water.
When you say salt water, we're talking about saline.
Saline.
Okay, good.
Okay, but the key is during the consultation, is to educate the patient and give the patient different options. Okay. And basically, what we're trying to get the patient to do is to make 4 decisions. Number 1, where should the incision be placed? Number 2, what is the size that that patient desires? Because the doctor should not, in my opinion, should not dictate how large a patient should be.
Does that go on?
All the time.
All the time,
yes.
Okay.
In fact, I would say that in the majority of instances, the doctor decides how large the patient wants to be.
But how am I going to know what an implant's going to look like? I mean, isn't that really?
Well, the way they do it is
with the bra. So that's accurate then. That's pretty accurate.
Absolutely. So they put their dream bra on, and then they try a variety of implants, and they decide for themselves the best size to suit them.
So they come in thinking they know what size. Sometimes.
Sometimes. All right,
and then they say, "Oh my goodness, that's too big."
Exactly. And so when they try their dream bra on, what we do is we try a certain size implant on one side and another size on the other side, and then they.
So these right here, what we're looking at, this is just how big is this? What size is this?
That's a 400 cc.
So 400, okay, and then they just go down. I can read it there, 375, and that's.
No, these are all the same size, but this happens to be what we call a low profile.
That's a 375, that's a 375?
And this is a 375.
Okay, interesting.
This is a medium profile, and this is a high profile.
So they're all 375s, but they look, because you can't see it at home, these all look different.
Exactly.
Okay.
And this is wider and lower, and this is more narrow and higher, and this is even more narrow.
But doesn't everybody want height, that projection?
Some
like
do.
Everybody wants
some
the middle
do, and it depends on their basic stature.
Okay.
And some people have a very petite frame, and they want a lower profile. Some people want to have excess projection, and so this is a more ideal.
Okay.
But the key is that during the consultation, they can try these implants, and they can try the saline-filled implants, or they can try the silicone-filled implants.
Much better.
Okay. To me,
I mean, that feels like a water balloon. This is like flesh.
Exactly. There's no
Very
question,
nice.
no question about it. Okay. And the other thing that you should see is this: is that You see, with a saline implant, you can see this scalloping.
The creases.
It's scalloping. See,
interesting.
All right. Well, with a silicone implant, you see a very smooth surface. You never see scalloping.
Nice.
Okay? All right, and so that's just another factor. But the point is that the patient has a preview of coming attractions.